Shannon, thank you.
You're welcome. So do you want me to just admit Karen for now?
Who else is waiting?
Nancy Boudreau.
Just let Karen in.
Okay.
And we have to test her PowerPoint to make sure it works.
Yeah, I'm gonna make her the co-host now.
Hello.
Hi, Karen.
Hi, Karen.
Hello. How are
Here we go.
you guys?
We'll show up as real people now.
Well, I emailed because I wasn't sure if I was on the right link, so.
No, I think we've had a couple changes in terms of how we manage the Zoom thing, and I think we just took a little bit more time getting in, but we're here.
That's okay.
And Shannon is going to work on giving you access so you can do the PowerPoint and move through it.
Okay.
Karen, you're now co-host, so you can try and share your screen.
Okay. Let's see.
Down at the bottom, there should be a thing that says share screen.
No, I know. I'm trying to pull up the right thing
The
here so
PowerPoint.
I can share it. I had it up, but hold on. Let me go back here. I'll just pull it up here. I wasn't sure if you guys were going to load it.
We can do that if you want.
No, I think I have it. Let's see if it'll pull up. Yep, we got it. Come on, load. There we go. Let me just make sure of a couple things here.
Yeah, it's not showing on our screen yet, but
No, I haven't. I'm trying to, it won't let me. Because it's a link, it won't let me X out of some other things, which I guess is okay. As long as it shows the correct screen. Come on. If you, can you guys pull it up? I have it here. I'm just afraid it's not going to go into slideshow.
Shannon, do you have it?
No, I never received it.
Okay, let me send it to you.
Well, I'm not staying on this call because I have another meeting. So
Okay,
once everybody's admitted, I have to drop off.
Actually, I think I got it. I just want to make sure it doesn't, my emails don't come across, and it's not letting me block out my emails. I have the presentation up here, but it won't let me try this. Hold on. Because I certainly don't want 100 people seeing an email.
No.
That's the problem. And I don't know why it won't. Let's try it this way. Let's see if it'll do this. Okay. Let's try doing this, and then we'll do this. If not, you guys are going to have to pull it up.
Okay, I have it, so.
I think this will work. No, it's pulling up the wrong one. It's not saying, yeah, if you want to pull it up, do you have it?
I have it, and let me see if I can share a screen.
You may have to move it for me. The problem is Danielle sent it to me in a link and not. So it's reverting to my old one, which is not as pretty as the one Danielle gave me.
Huh.
I might be able to put it on Google. Like, it might be able to do it that way. Nope.
I'm having trouble too.
Dave, do you have it as a PowerPoint? Do you have?
I have it as a PowerPoint. Yeah, I do.
Okay. So if you pull it up on your screen, you should be able to share that. Like if you pull up the actual PowerPoint presentation.
Okay, I have it up.
Okay. Now you should be able to do share screen.
Oh, let me stop.
I mean, I have it here. I'm just afraid my email is going to come across and it won't let me get out of my email and show it at the same time. Oh, let me try that. I might have just done it. I might be okay. All right, let's try it this way. I hope I'm all right.
Oh, yeah, good. Great.
Perfect.
Yeah, but I'm still worried that my email's gonna come across, but I think we're okay because I managed to X that out. So if at any point you guys see my email,
We will, yeah, we'll yell at people if they say anything and we'll try to see what we can do to hide it.
well, the next question is how to get it to go from slide. Oh, never mind.
There you go.
Slide. Oh, go back. Go back. Just leave it there. Okay.
Okay, good. Got a couple minutes. So what we'll do, I do some stuff at the very beginning. I'll welcome everybody. John Weidenhammer, if he's on, I'll introduce him. He's the head of the Berks Alliance. He's the chairman of the Berks Alliance. He's a local businessman. He's also, I think, serves on the board of the Reading Hospital and served on the board of Tower Health for a while. Then I'll talk about generally the topic that we're going to talk about today. I'll go over some ground rules. What we're going to do is ask people to submit their comments on the chat function. I'll collect those and then raise them. If there are questions or comments, raise them with you when we get to the end.
Okay.
In recognition of your time, we'll try to have a hard stop at 1 o'clock, depending on what people have to say. Then I'll do a brief introduction after I go through the ground rules, telling people, keep your face open so we can see that there are real live people here, but keep your microphone muted. Then I'll do an introduction of you and the topic.
Okay.
Okay.
The only problem is my mute and microphone has gone away. It's
That's
very
fine.
odd. Oh, there it is. It just went over here. Okay. Everything shifted over here, which hopefully is okay. Okay.
Okay.
All
And
right,
as
Dave, are we ready to let everyone in?
I think we got 20 people waiting. Yeah, we can let them in.
Okay.
Well, why is it not on my?
Sure. What's that? I'm sorry.
Why is it not working?
We're going to ask you to mute yourself when you come in. We'll get started in a minute here. John, I'm going to call on you after I welcome everybody. That's okay.
Sure, that's great. Thank you.
Andrew. Hi, John.
Okay, I think we will get started. I'm going to welcome everybody to this Spotlight Community Forum. We will be moving into the actual program in a minute, but I want to do a few quick things beforehand. I'm Dave Myers. I'm going to welcome you to this event on behalf of the Berks Alliance. And I'm going to turn it over very quickly here to John Weidenhammer, who's the chairman of the Berks Alliance, for a welcome as well. John?
Hi, everybody. Good afternoon. John Weidenhammer here. I'm the chair of the Berks Alliance, and we're just delighted that you're able to join us for this really exciting presentation this afternoon. And we're grateful that Dr. Restifo is going to take us through the facility and what it really holds for our community. But this medical college here in Reading and Wyomissing is really the culmination of a lot of hard work from an extraordinary number of people to bring it to fruition. And what we have here is really literally a state-of-the-art learning facility. And one of the benefits to our community is that it's known that many of the physicians that graduate from a medical school stay in the region where they went to school. So given that we have a coming doctor shortage and nationally and probably globally, it's really a good thing that we're going to have a path to minting some more doctors right here in Berks County, and hopefully a lot of them will stay with us. I've had a chance to be in the facility. It's really extraordinary, and we're just delighted that Dr. Restifo is going to talk to us about it. So again, we do these community conversations as the Berks Alliance every month. Typically, they're on the third Thursday of the month, but we're going a little bit out of sequence here so that we can get this important conversation going today. So Dave, I'll turn it back to you, and thanks so much, Dave, for your work in putting this together.
Thank you, John. Yes, this is a very exciting project that I think the community's been anticipating for a while, and it's going to have very significant direct and indirect benefits for the community. So that's something we're excited about. I want to also mention that we are excited to bring Drexel to Reading and the Reading area. When we were forming the Berks Alliance, John Fry, the president of Drexel, was very, very helpful in encouraging us and showing us what to do. Drexel itself has been a leader in community revitalization in Philadelphia. So it's a good model for Reading, a good model for institutions here in Reading, and we appreciate that. And I also want to thank the other partner in this enterprise, and that's Tower Health. Tower has worked with Drexel to bring the medical school here. Tower Health was also very instrumental in helping to form the Berks Alliance. So there's a small nexus of everything coming together. I'm going to quickly introduce our speaker, Karen Restifo, who holds both an MD and a JD degree. And she is the Regional Vice Dean of Drexel University's College of Medicine at its Tower Health campus in West Reading. There, she is leading the establishment of the new four-year campus for Drexel. She came to Drexel from the Keck School of Medicine at the University of Southern California, where she served as an Associate Dean of Student Affairs. And before her time at USC, Dr. Restivo was an Associate Dean of Student Affairs at the University of Arizona College of Medicine at Phoenix, and at the Texas Christian University and University of North Texas Health Sciences Medical School. During her time in Phoenix, she was part of the school's transition from a regional campus to an independent medical school. And in Texas, she helped establish a new medical school formed by a two-university partnership. She is by training an emergency medicine physician and spent 10 years at the Yale University School of Medicine, but she left her medical practice to stay home with her children. So that's a challenge lots of women in particular have faced. During that time, she attended the University of Connecticut School of Law, completed a medical ethics fellowship at Harvard Medical School, and took care of her children. And she has served in leadership positions in medical organizations and spoken across the country on a variety of topics. And we are just really pleased, Karen, to have you here to Reading. And we will now turn it over to you.
Well, thank you very much for having me and the kind introduction. I have some prepared slides, leaving plenty of time for questions, kind of give everybody an overview, hoping to cover many of the points that and things people want to know, but obviously if there are any questions, happy to answer them. We are thrilled to be in our new building. Very grateful to Drexel and Tower Health that we are here. Our students, we have 40 first-year students who started a little over 3 weeks ago. They had their first test on Monday. We're all still standing, so that's a good thing. So we're going to start with a picture. This is our building. For those of you, I think pretty much everybody probably knows where we are, but the landmark we use is the Friendlies. We're across the street from the Friendlies near the Teleflex building. And this is a recent shot. Every day we have new things. We had a new sign put up yesterday, so it's always changing. I'm going to start with admissions. We take 300 medical students. I think there's going to probably be a fair amount of questions about the admissions. We take 300 students in total, 260 for the Queen Lane campus in Philadelphia and 40 for our Reading campus. When the students apply, they cannot say, I only want to be admitted to Reading. I only want to admit to be, apply to be in Philadelphia. They apply to be one of 300, and after they are accepted, they can preference which campus. Last year, we had almost 17,000 applications for 300 spots. Sometimes people say, well, you have difficulty filling your spots. The answer to that is emphatic no. 17,000 applications. That was a 20-some% increase last year, and the applications for next year are already up by another 20-some%. So we're probably going to hit over 20,000 applications. As I said, the accepted students had an opportunity to submit campus preference after they were admitted. I have a director of student affairs and admissions, he and we now have a student affairs dean talk a lot to the applicants as they interview and look at the different campuses and the different things that are going on. And so they learn about both campuses before they make that decision. The final assignments were completed. Yeah, that's because we have 40 here, and 40 students started orientation on August 2nd. So they have a week of orientation and then they start class. I'm going to keep going. We hired 27 faculty and professional staff that are onboarded. We have 3 left to go, which are for the second year curriculum. We hadn't hired them yet on purpose because we didn't need them yet. Some of the faculty are part-time. A large chunk of them are full-time. Virtually all the staff is full-time except for 1 person so far. And 2 additional faculty and staff will be hired for year 2, plus a 3rd part-time person that's going to be working in anatomy. You can see 2 of our staff in the picture. The gentleman on the right is our director of student affairs and admissions. I think a bunch of people in the community I've already met or so. And the woman on the left is Laura Ronan, who is our assistant dean of student affairs, diversity, equity, and inclusion. The building, we were able to get into the building on July 12th. Construction is basically completed. The trailer is going to leave within the next couple weeks. We're still waiting for some furniture. Unfortunately, we're waiting for the sectionals for the student lounge. That's kind of a key thing we need, but that's all right, they'll come. And we have some pictures down the bottom that you can see. I have a fair amount of pictures coming up, but I don't know if you can see my cursor, but this is the anatomy lab. The building is built to handle 100 students per year. And this is a very large room with, as you can see, television screens. So as things occur with the donor cadavers, the students can see and participate in those types of things. This is our central lobby, which has this really cool 2-story foyer that has, if you were either at the opening event or saw it in the paper or something, you will recognize that spot. We have 2 large classrooms, one of which is a stadium type classroom. Both seat 100 to 120. This is the one that's the stadium type. So we're very, very fortunate. The grand opening event, as you can see, there's President Fry was in attendance, Dean Cairns, the provost, Sue Parati, all sorts of people were in attendance for our grand opening event. We have 3 large scale murals within the building. This one here goes to the history of Drexel with Women's Medical College in Hahnemann, the history of the Drexel Medical School. We also have a very large mural featuring Reading with pictures of the knitting mills, the railroad, Reading Hospital, the pagoda, those types of things. And we also have a mural basically that's in the student lounge that shows the Drexel dragon. You got to have some dragons. These are our 40 students who are standing in the lobby. And this was during orientation. So they kind of lined up. We took a nice shot of them. These are some of the building spaces. So I'm going to give you a little bit of a tour. We're working on some virtual tours that might be available to the public over the next couple months. But we have a movement studio, yoga room. You can see the exercise balls. The students are already using this. They've had little classes in there masked. By the way, I don't know if people are curious, all of our students are required to be vaccinated or get a medical exemption or medical or religious exemption. All our faculty and staff are also required to be vaccinated. The same rule applies. That said, we're all masked in the building. That is the current recommendation through Drexel. This is our 2-story foyer with a really cool stairwell that goes up to the 2nd floor. The mural that is about the medical schools at the top, medical college is at the top of the stairs. The 3rd floor has a beautiful terrace with some pretty spectacular views of Reading. And these are 2 pictures of the terrace from the inside. And this is the actual terrace from the outside. Again, we have some other pictures of the interior. This is the anatomy suite where some of the dissection occurs and a lot of the learning. These are some of the small group study rooms. This is the flat lecture hall. The first test occurred in here. And this is a multi-purpose room where the chairs can be moved around, the tables can be actually stood up, and so they can be pushed against the wall. And we have 12 clinical skills rooms. The students obviously need to do physical exams. We hire standardized patients who are basically actors and actresses who present the students with various cases, and the students interview the standardized patients, and the faculty watch them from a control room and give them feedback on what they could be doing better. So we have those 12 rooms. We also have 5 simulation rooms. I don't know that I put a picture in of that. We have a full operating room. We have, the last count, 7 mannequins. We have some adult mannequins, some male mannequins, some female mannequins, some baby mannequins, and a female mannequin that delivers a baby. So this is where the students practice all sorts of different things to make sure that when they go out and take care of human beings, they are skilled at what they're going to be doing. You may have also heard that our students got involved with painting a mural pretty soon after their arrival. One of the hallmarks of Drexel is, and particularly the College of Medicine, is that we have a lot of community service embedded into our curriculum. And the expectation is that the students will get very involved in the community, and that is part of being a physician. And we pick students accordingly. We tend not to pick based on academics alone. Obviously, they need to have a certain level of academics to make it through the curriculum, but we want future physicians who are going to give back to their community and interact with the community. So the mural was really a lot of fun. We were fortunate enough to go over to Reading Hospital and meet with some Tower Health individuals, and the students and the dean and a few of us walked back from Reading Hospital. We're able to have a tour of the mural in West Reading. A lot of the murals, see the history. These are a couple of our students standing in front of the butterfly. And then we came back to the building and helped paint a mural, which will go in downtown Reading. The mural theme was mental health awareness and suicide prevention. So I think that was a huge amount of fun. Got us off to a very nice start. Many of you may have seen this banner that I, at least temporarily, was brought down in one of the storms, but thought it was important to show the banner. I think the students have felt very much welcomed by the community. You may have seen them walking around the first day of orientation. It was fun for me as I was leaving the building. I could see a whole bunch of them with their little Drexel bags walking across the bridge over to the Wawa. And it was like, they're here and we're ready to go. So at that point, I'm going to stop sharing so I can answer questions. That completes my slides. And happy to answer any questions that come up.
Well, let me start with a few, Karen, that I have and that have been raised by a few people. And you can submit your questions through the chat function, or we can do it this way as well. Raise your hand. There's a way to do that, and let us know that you would like to ask a question. So you had said that the building is fit out for 100 students. Is that sort of the maximum capacity, or is it 100 students, potentially 100 students each year could be admitted?
It's 100 students each year. So, the traditional medical school curriculum, which we follow pretty much, we have a very integrated curriculum with a lot of interaction and a lot of case-based learning and problem-based and team-based learning, is that the students are predominantly in classroom interaction type scenarios for year 1 and year 2. So in year 3 and year 4, they're not as much in the building. So the building is built. Most of the use of the building will be for the year 1 and year 2 students. So it's built for 100 per year.
Okay, so potentially you could have up to 400 students.
That is correct.
Right.
The 3rd and 4th year students, once our 40 first-year students become 3rd-year students, they will rotate at Reading Hospital. The Queen Lane students have a number of options available to them for year 3 and year 4. The students who are on the Reading campus will go to Reading Hospital and will not be in a more of a generalized lottery to go. We have regional campuses in Pittsburgh, in California, a variety of different places in Philadelphia. They will stay in Reading. That was part of the plan. And they will also stay in Reading for their required 4th year courses. So they're here for all 4 years.
Good. And the 27 faculty, is that the size of the faculty over time, or is it going to get bigger?
If we go to 100, then that will increase depending on what we need. So the current faculty is sufficient for 40 students per year.
That's a pretty good student faculty ratio.
Yeah, they're pretty spoiled right now, but that's good.
Which might be a big attraction for future classes coming in, knowing there's that kind of a relationship. Where are the students living?
Well, they're living all over the place, actually. I think they're living in the Wyomissing, West Reading area. As everyone probably knows, the housing situation in this neighborhood is pretty tight. But they were able to find housing. I think some of them live with other medical students. Some of them live by themselves. Some of them are commuting. I think some of that depends on where families live, where significant others live. So we have a nice interspersement of a bunch of different situations. So we try, one of the things that's important to realize is that medical students, by the time they graduate, are typically $200,000 to $250,000 in debt,
Yeah.
which is a huge burden. So we try to help them find housing that is affordable, and we try to help them find housing that does not necessitate a car. So I think many of them are within walking distance. We do not provide housing for them. Most medical schools do not have dorms or provide housing. So, they are graduate students. So many of them have found housing. We are in process of getting some bike racks because we've seen a fair amount of bikes here, which is great. And the bike racks just haven't come yet. We knew that they would probably be needed, but they haven't arrived yet, but they should be arriving soon. So we were a little concerned about the housing, and our director of student affairs and admissions was reaching out quite a bit, but they seem to be okay for the moment. The next 40 we'll see. Yeah.
Right. And as it gets bigger, obviously.
Yeah.
the need
So
would be
if it would make sense if it's possible for someone, if they have the means, to develop an apartment building or something, because I think it would be
an attraction.
probably pretty well populated depending on the price range.
What can you tell us about the demographics of the students? Are most of them from this area? Are they where are they from? Are they the age, that kind of stuff?
So they're from all over the country. We're a private medical school, so we take students from everywhere. We do have a few local students who either grew up in Reading or nearby communities, or depending on what you consider local, people who went to colleges that are not all that far away from the Reading area. We have on our campus, we have some California students, we have students from Texas, we have students from Florida, we have students from all over, which is a really nice, obviously we want a diverse class. You can define diversity in a variety of different ways. I think each of them add an element. We do have students that didn't come directly out of undergraduate situations. We have people who have had previous careers. We have people who have children. We have people who've been in the military. We have all sorts of individuals who weren't necessarily science majors. We're fortunate enough to have the previous dean of the medical school on our faculty directing bioethics and humanities, Dean Shidlow, for many of you who know him. He donated a piano, and we're already hearing piano music because many of them are musically talented. They're also apparently athletically pretty darn good, because all of the medical students are divided into societies, and the societies help them bond in smaller groups. So at Queen Lane, there's 6 societies of 40 students. We have 40 students, so we have 1 society. The society name is Pagoda. Gee, I wonder where that name came from. And every year they have an Olympics where the societies compete against each other. And I'm very proud to say that this year, the Olympics already happened, and the Reading students won. They beat out the Queen Lane students, all the other societies, and they won. So we are, apparently they're collaborating already and quite good at getting stuff done. So out of the gate, first year in, they won. And we have now we have to find a trophy case to put the trophy, because I guess we get a trophy. So we're on Amazon trying to find a trophy case.
Yeah, and another addition to the building.
Yeah.
Are the faculty members living here locally? Or are they commuting from Philly or what?
Again, it varies. There are some faculty that live quite nearby. Some faculty who are trying to get a house in this area, which is not an easy accomplishment right now.
Right.
We have some who live between here and Philadelphia, and a sprinkling of staff who live in Philadelphia and commute. They're scattered all over Pottstown, Phoenixville. some here. We also hired a few staff members that actually live locally, who've been involved in the community. That's been exceedingly helpful. And
Okay.
some of our faculty are current Tower physicians who already lived here. We have a few from Reading Hospital. We have a few from St. Christopher's.
I know Drexel's been very supportive of the efforts to bring back passenger rail to Reading. So sort of wondering where that, you said there are staff. How many staff people are there in addition to the faculty?
Well, the 27 includes faculty and staff. So
Okay.
all told, we probably have, I would say about 10 of those individuals are staff.
Mhm.
Yeah, so for example, we have Director of Admissions and Student Affairs. We have an academic support specialist who helps the students with their study skills. We have an administrative coordinator who helps myself and the Student Affairs Dean. We have a Director of Admission and Finance. We've basically paralleled the staff at Queen Lane on a smaller scale. We have 2 AV people who help us deliver the curriculum through the audiovisual, those types of things. We have a director of simulation and clinical skills. We have a simulation tech. We have anatomy lab tech. We have 2 people who just simply help deliver the curriculum. One who helps, we do a large program called Healthcare Advocacy Practicum, where the students as part of the curriculum go out into the community to learn and to help. We've already signed with 25 community organizations to where the students will be going out. They'll be picking where they want to go. And then
Great.
we're in process of setting up some of the volunteer activities. And some of the coordinators help with those types of things. So they're off and running. I started last September. I was the only one here. And since that time, we've onboarded everybody. So it was a little lonely in the beginning,
Yeah,
but now we have basically a full house.
you're building a crowd, yes.
Yes.
What can the community do to support you? You already talked about community organizations that the students can work with.
Well, there's a
more can
couple
we do?
different things. I think if people want to know if the medical students should be involved in their community organization, please feel free to reach out to me. I will connect them with the appropriate individuals. Gene York, who is a Tower physician, is helping to run our healthcare advocacy practicum. So those of you who know him, he's coordinating a lot of those activities. What the community can do is what they're already doing. They're embracing our students with open arms. If you want to put up an apartment building somewhere, that would be fantastic. But I think a bunch of people have helped organize some student discounts. Again, that's always greatly appreciated. But it's also what they can do for the community. We're very serious that we're here to help. The students want to help. They're getting their feet on the ground right now. But as we get further along in the year, you'll start seeing them in more formalized activities. Right now, they have to kind of figure out how they should study, which is very different than undergraduate. It's a lot of information coming at them very, very quickly. But everyone has been honestly fantastic. We've gotten a lot of support from Tower. We've gotten a ton of support from Reading Hospital, a ton of support from the businesses. People have just been excited and helpful.
Good. Yeah, COVID has disrupted a lot of things, including the practice of medicine. How's it going to affect the medical school?
Well, I mean, we're lucky so far this year. Our goal was to have in-person classes so the students could get to meet each other. So far, so good. It's a little frustrating for them, I'm sure, to have to keep masks on and to eat outside. Basically, they're supposed to eat outside, those types of things. In terms of affecting their training, I think we're doing everything we can to keep them on target and to keep them learning. The 3rd and 4th years have been continuing to rotate in Reading Hospital and hopefully helping as much as they possibly can. It's been a unique experience. It's been hard on the medical students, but it's also been a hopefully once in a lifetime experience for the students that are out there working clinically. And our students will help in whatever way they can. We had a conversation yesterday about booster shots and what our students can do to help make sure those, if there's a way they can help, if they can help with any awareness campaigns, they can be helpful along the way. Like I said, they've been vaccinated, they're learning, and we just need to keep them progressing through the curriculum so that they can get out and help.
One of the challenges that COVID has presented is for sort of at-risk populations, and Reading is provided, I think, the medical school with a good population of at-risk people. We are economically very diverse, ranging from the city, which happens to be the poorest city in Pennsylvania, to some very wealthy communities around here, ethnically and racially diverse. How is that an attraction for medical school students and for the medical school?
I think it's a huge attraction, particularly for the students that Drexel attracts. Like I said, we're known for community service. Medical students want to take care of patients. They want to take care of patients from all different backgrounds, from all different communities, from all different scenarios, whatever that may be, socioeconomic, cultural. So it is exceedingly attractive, I believe, for the students in Reading, our campus, and they've said that this campus was very attractive to them because of the diversity of the community, also because of the diversity of the patient population that Reading Hospital serves. You have a hospital that's less than a mile away from our students, where they will spend the vast majority of their time. That is a very large level 1 trauma center hospital that sees a lot of patients with a lot of different problems. There are other medical schools where you have to go to a number of different hospitals to see a number of different patient scenarios. That's not the case here. I'm not saying one's better than the other, but for those who come here, I think it's a distinct advantage for them. And so that has been a question that they've asked frequently as they've decided between Drexel and other medical schools. Will I see a diverse patient population? Will I be able to work in a diverse community? And I think that has been helpful in terms of having students not only choose our medical school, but choose this particular campus.
Good. The third and fourth year residents have been physically around here for some period of time, right? How long have they been here and what have they been doing?
So they're third and fourth year students. Residents is when they finish medical school.
Yes,
It's
that's
very
true.
confusing. Yeah.
I'll get my language correct.
So third years traditionally, they do required rotations. So they'll do a surgery clerkship, a medicine clerkship, a OBGYN clerkship, a pediatric clerkship. And that's what the Queen Lane, Philadelphia students have been doing. And that's what the Reading students will be doing as well. We do have some students from Philadelphia. We have some students from Philadelphia currently in year 3 and year 4 who are assigned to Reading for the entire year. So they've been here. I'm not sure how long, I think a long time. And they've been here. They have been living here, which has been great because we've been having them having conversations with our first years. We said to the third years, can you help them find a place to live? We also have some third and fourth years who kind of drop in. They'll do some of their time at Chestnut Hill, then they'll come up and do some of their time at Reading. They're here for 4 weeks or something like that. Then they'll go to do some of their time at St. Christopher's. So there's a combination. So that's always happened. So what's great about that is it won't be a new phenomenon when the first years become third years. There'll just be more of them. And people will be used to having the medical students, and the faculty already know what they're doing. They're familiar with what a third year medical student looks like, what a fourth year medical student looks like. We have, as medical schools have, there are department chairs. Reading Hospital obviously has department chairs within the hospital, but Drexel, the School of Medicine, also has department chairs that are scattered around our regional campuses. 3 of those department chairs live in Reading Hospital, surgery, internal medicine, and OBGYN. So they're very well integrated into the medical school, the faculty, and how it works. So that's already been in place, and it's been a huge advantage for our campus. When we need something, every chair has been very, very helpful, but those three have been particularly helpful because they're integrated not only in Reading Hospital, but with the Drexel system.
I've heard very great things about the building and how and the facilities and how wonderful they are. How do they compare with what the students get at the Drexel?
Fun, joy. All right,
How do
take
they
care.
compare with what? I'm sorry.
What's that? Yeah, well, it'll be fine. Yeah. Yeah, I know.
Sorry.
That's okay.
How does the facility here compare with what the students have at the Drexel campus?
So that's a tough question to answer because
And it may be politically incorrect
well,
to ask.
it's there's a fair amount of luxurious space up here, and Queen Lane is a great campus. It's a little tighter. There's 260 students there. It's a great campus. They're getting great education. When people tend to come to the Reading campus, they notice that, you know, it's not as tight. So there are advantages and disadvantages to everything, right? So the Reading students are very fortunate. They have this beautiful building. They're not as close to main campus. The Queen Lane students are closer to main campus. Students would frequently ask as we were recruiting, which campus should I pick? And the answer is not which one's prettier, which one's bigger, which one has new equipment. The answer was, and what I told them personally was, you should pick where you're going to learn best. If you want an inner city, and believe it or not, I used to use cheesesteaks as an example. If you want to be able to get up at 2 o'clock in the morning and go to Pat's or whatever, then Philadelphia is where you belong. If you like a Wawa cheesesteak, then maybe Reading is okay. So it's where you, yeah. I don't know if there's any cheesesteak places around that are open at 2 a.m., but I know in Philadelphia you can get a cheesesteak place. So we use that kind of half kidding, but half serious. If you're going to learn best, if your family lives in downtown Philadelphia and you're going to be near your family, then that may be where you want to be. If you want a little more space and you want to be able to walk out the front door of your apartment and pretty quickly, be on a bike trail that's, allowing you to get away from a city, then this is the place for you to be. So that was the advice we gave them. They also, I think, took into consideration the population they wanted to serve. And also, this is a startup. So many of them were interested in being the first class to help set up the student interest groups, to help set up all those types of things. And if they kind of feel more comfortable with an established set of groups or whatever, then it was Philadelphia. So comparing the campuses, we kind of had encouraged them to do that individually on their own and not competitively, if that makes any sense.
No, that makes a lot of sense. Are there things you're planning to add to the facility that aren't there yet, or things that you would like to add to the facility?
So the short answer to that is no. I think there was a huge amount of planning done, and we are very much indebted to Queen Lane before any of us got here. So, the students coming from Queen Lane came up and said, this is what a student lounge should look like. The anatomy people came up and said, this is what anatomy should look like. There are very few things that were missed. One of the things that was missed was we forgot we needed microwaves. So we fixed that already. We think, somebody thought that was included in the building package. The rest of us were like, wait a second, where are our microwaves? And so it's been little things like that. And there was a lot of, the architects had done a lot of medical education buildings. So I think that was helpful. The Queen Lane individuals involved were somewhat visionary on what we would need as we move forward and technology continues to improve. So there's nothing yet that we're going to try to get a basketball hoop, but those are the kind of little things that we're working on. Nothing crucial.
Nothing big. Good. As I understand it, there's still some open space in the building too, the top 2 floors, is that right?
That is correct.
What's going to happen there? Do you know?
It's unclear that that is not up to Drexel. So it's unclear what's going to happen to that space.
Okay.
Yeah.
I know that there are some immediately adjacent to the facility, there's a medical device company. Is there any sort of partnership relationships with those kinds of things, medical devices or some of the life science industries that are in the area?
Not yet, but I think we definitely want to have conversations. Like I said, right now, we're really trying to get our feet on the ground and make sure the students are taken care of. And then there will be opportunities. People have approached us, for example, for different things. Combining, a good example is, what can we do with some of the residencies over at Reading Hospital and Tower? We definitely want to partner and, have people come over and share the simulation or whatever. Right now, we got to make sure that the curriculum is done and done well, and then we'll get there. But right now it's really, we're ordering stuff for the anatomy lab. It's like, oh yeah, we need this, we need that. The mannequins are still showing up for simulation. So we really are in the weeds, and then we definitely will branch out. And I think we welcome any opportunity to discuss partnerships that, with anybody, particularly across the street, or within the community.
Is it likely that the students who go to the medical school here will do the residencies in the area as well?
That's the hope. And we have seen that in different places. And I think that was mentioned in the beginning. There actually have been studies that the studies have more been about residencies, and people who do residencies usually stay within a 100-mile radius of where they train during residency. So if the hope is that the students will really like being here, will love Reading Hospital, will do Reading Hospital Tower residencies, and then be inspired to stay and be attendings, faculty, physicians in the community. That is the hope. And I think a fair amount of people around the country, one of the places I used to be, that was the goal too. And you do see that as the students start progressing. 100% of them will not stay, but a chunk of them will. And that makes it makes a lot of sense, because they get to know the communities really well. They get to know what is needed. They get to be familiar with, I think a lot of our students are going to be inspired by the physicians over at Reading Hospital. And you see that they become inspired by somebody, and then all of a sudden everybody wants to be X. They want to be a radiation oncologist. And I'm like, what's happening with all these radiation oncologists? It's usually somebody who took the time and talked to the students and inspired them. And the students were like, I want to be like that person. So we'll start to see that.
As I understand it, the relationship between Drexel and Tower also resulted in a number of residents being a significant increase in the number of residents connected to the Tower system. How does that relate to the medical school? I mean, you already alluded to it a little bit. But.
Part of the problem, when somebody mentioned the physician shortage, is a lot of medical schools have been increasing their class size. There are new medical schools, and that is desperately needed. So I think it's great that we now have 40 students here. The kind of logjam is residencies. So when you graduate a lot of medical students, when you have an MD after your name, you can't really practice in virtually any state in this country. You need to have graduate medical education. So the fact that the residency slots have expanded at Reading and Tower is phenomenal, because we will funnel our students into those residencies. They will need slots, and they will be familiar to the Reading Hospital physicians. And when you're familiar to people, you tend to like to take them into your residencies as opposed to people you don't know. And hopefully you create this big pipeline. And so that is what is necessary when you start adding more medical students, graduates to the equation. They need to have a place to go. And many of them want to stay, but if they want to stay in an area, they are limited by the number of residency spots in the area. I've been in states before where there's been 2 otolaryngology residency spots in the entire state for all the medical school students that are coming out. And you would like them to stay, but there's no place for them to go.
Yeah.
So they'll go wherever the spots are, which may be Northeast or maybe California or maybe Texas, and that's where they're going to stay. So the more residency spots, they may come back, but a lot of them are going to get familiar and like it there. So the more residency spots we can have nearby, the better chances that the students will stay. And probably the better care, because the more they get to know their patients, the better
Right.
they're going to be at delivering that care.
So this isn't your first go round as a pioneer creating medical schools. What did you learn at the other places that you've been able to apply here? What could we be doing differently here that you would have brought from the other places?
Well, a couple different things. When I was in Texas, it was 2 different entities coming together. So I think that was helpful before I came here. And then we have Drexel and Tower coming together, which is well-meaning people. But it's always interesting to combine 2 different cultures. And, you know, when you're talking about security, okay, who's going to do the security of the building? What does that look like? And this is what it looks like at Drexel. This is what it looks like at Tower. So I think that was helpful. I was in Phoenix when we went from a regional campus, a year 3, year 4 campus to a 1, 2, 3, 4 campus, and then independent campus to see how you take care of medical students in a smaller class size and how you start with a class that's brand spanking new and who used to refer to themselves as the guinea pigs, and you advantage that. You don't want them to feel that being guinea pigs is a negative. You want them to feel that being guinea pigs is a positive. And I'm hopeful that our running students are feeling like they're positive guinea pigs right now. So I think that was very, very helpful. And also just having an experience in a variety of different communities between Phoenix, LA, New Haven. In many respects, this reminds me of New Haven, at least the hospital reminds me of the Yale Hospital. A very diverse patient population with a very large catchment area with a lot of residencies. And so I think all of that has helped.
Yeah,
So,
that's interesting. You mentioned New Haven in that direction. I think the former head of Reading Hospital, Bill Jennings, was from New Haven.
yeah, so he and I used to talk about that. Yeah, it's a somewhat similar scenario where you have a very large hospital in a town that is very, very diverse. New Haven
Yes.
is incredibly diverse.
Yes.
And when you put Reading, West Reading, and Wyomissing together, you get a similar distribution of diverse for all sorts of reasons. It's somewhat similar, and they're all going to the same hospital. So it reminds me of that.
Yeah. So what's your favorite thing about Reading, West Reading, Wyomissing so far?
Well, a couple different things. I was incredibly surprised and impressed with the ability to be outside. The museum, the planetarium, being able to walk around. We've told the students about that. I've been impressed by what's happening in West Reading and the ability for people to, the different restaurants, those types of things. I think it's this whole area is a gem that's basically more people need to know about. And I think our students will become ambassadors. And everybody's been incredibly welcoming all the way through. Neighbors, store owners, to the students, to everybody. And as a bunch of us have been reaching out, you know, people are just very excited. And that is, in order for this to be a success, the community needs to be excited, remain excited, and be supportive.
And I think it is. I think the community is
Yeah.
very, very excited to have you here. It's next to bringing passenger trains back. It's the one thing that I think excites everybody.
Well, we're excited about the possibility of passenger trains. I know the students would love that. They can just jump on the train and go see the people at Queen Lane. And I think all sorts of people would be excited about the train.
Right. Any other questions anybody has that we haven't been able to get to yet? We've got about 10 minutes left, so I don't know if you have a 10-minute wrap up, Karen, or not.
No, I just wanted to, what I wanted to do was say thank you, honestly. There's a lot of people, I can see some of the names on the screen. There's a huge amount of people who have been helpful to us. And it's working. I've not heard a single negative thing from a student. Everything has been positive. I will tell you that as part of orientation, we have the second year students from Queen Lane come up and help the students get oriented and do programming. And every one of them was like, can I transfer here? I said, well, unless you want me teaching you personally, that's not going to work because I don't have a second year curriculum. So it's infectious. And it's really infectious. And I think we all appreciate that. We appreciate what this community did to get this up and running, which it was not singular to Drexel or Tower. I think there was a huge amount of community involvement that made this happen. It's pretty spectacular that it happened during a pandemic. The construction guys couldn't have been better. It's been a surreally beautiful experience. I go downstairs to the trailer and I say, what about X? And I turn around and it's being done. So it's really sincerely just a thank you to the community for being so welcoming, for getting this up and running, for the concept. Just a thank you.
I'm going to sort of exercise my prerogative here, and there may be 2 or 3 people that I'm going to call on to see if they have any questions. One of them, and if you don't, and hopefully this means you're still paying attention, but Dan Ahern is on from Tower Health, and I don't know if Dan wants to say something. Mark Radcliffe, who is the head of the West Reading Main Street program. I don't, Mark, if you want to say anything about the impact that the medical school is having there. And John, I don't know if you want to come back and say anything more on behalf of the Berks Alliance, the broader community, and your relationship with Reading Hospital. So your chance, guys.
Dave, this is Dan. I'll take a minute. I'd like to thank Karen for her passion and commitment to getting this school open. We had a very aggressive timeline. We had a lot of issues to work for, and Karen's been just an out and out hero, and we would not be where we are with the school without her. And with navigating partners, Karen's been an advocate for both partners, but mostly for the students, and she's done an outstanding job. We're lucky to have her.
Oh,
Great.
thank you, Dan, and thank you for all your help. I know it's been an interesting ride, and people have just been very centered on getting it done, which I think has been incredibly helpful.
Mark, presuming you're grateful to have medical school students in the middle of your community.
No question. We are incredibly lucky to have them here. If we can just create a bridge right into our downtown area from the school, that would be terrific.
I'm a fan of that. That's cool.
Yeah. So no, it's great. I mean, it's not only great to have a school, but to have such a smart group of kids coming to our area and looking to participate. I think it's terrific, and whatever we can do to support all of your efforts, we're here for you.
Mark has been having conversations with myself and a couple of our staff for a while, and has been very helpful, helping us, get the students here, get them going and figuring out what they should do. So I appreciate it.
We even have a house we're renting to 3 of the students. So
Are they behaving? I hope they are. I'm sure they are, but they better direct them to me if not.
yeah.
They're busy with medical school. Of course they're behaving.
Well, that's what I told them. I said, they make good tenants, but I'm kind of crossing my fingers that stays that way.
Yeah, just keep them busy.
Yeah.
And John, do you want to?
Well, I'll just finish by saying that this medical school is a game changer for our community. Clearly, there are a number of things that are going on that really provide an upward and accelerating trajectory for what's happening in our community. But this medical school is one of the pillars to the change that's happening around us. And I really think that in the end, this is going to prove to be a difference maker not just for the, for the quality of medical education, but for the community in general, because an enterprise like this has so many different ways to impact a community, not just through the education, but through the service of the students and the change in the trajectory of our economy. So I have high hopes and strong belief that as we look back 10 years from now, we'll see that this was a watershed event for Reading and Berks County. So Karen, thank you to your team, and thanks to all the folks at the Reading Hospital and Tower Health that made this possible. Of course, we had tremendous leadership and vision from John Fry and the team at Drexel. I saw or see that Chris Kraris is on the call. He's one of the Tower Health trustees, and I know that board really has put their whole heart and soul into this enterprise and made it possible. And really, when in the early going, when this was just sort of a glimmer in the eyes of the Reading Hospital and the Tower Health Board, and the first conversations with John Fry were happening, I think we all thought that, it was a bridge too far, that just this was an impossible endeavor and that we weren't going to be able to get it done. So to see it actually having been realized is really just amazing. It's amazing, and it took a lot of hard work and good thinking and collaboration among a lot of people to make it happen. So just on behalf of the community and the Berks Alliance, we're just so grateful to everybody that had a hand in this, large or small, in making it happen. So thank you.
Well, thank you to you, because I know a lot of people, my understanding before I got here, there were a lot of critical moments that people just made stuff happen. And so it's vastly appreciated. And the students, I don't understand it yet, but I think someday they will understand what a huge endeavor this was and what a big difference they will make. So it's very much appreciated.
Great. Yeah, I think this is a great example of how collaboration can bring about change and improvement in a community. And so a terrific example of that. Karen, thank you very much. Appreciate it. Hopefully this was enjoyable and not painful. And I want to thank everybody who was in attendance here. We have been recording the event. We will send a copy of the recording to everybody who registered for it. And I want to do a quick commercial for our upcoming community forums. We have 2 in September. We had 2 in August. We have 2 in September. September 16th, we're going to be doing a program entitled The Case for Early Childhood Education, and we'll be focusing on early childhood education and how that is a 2-generation transformative activity. And then on September 23rd, talking about transformation and community improvement, we're going to have the City of Reading unveil its Downtown Plus plan that has been working on for the last 6 or so months. So stay with us for that. September 23rd is the Downtown Project. September 16th is the Early Childhood Program, and we look forward to seeing many of you again. Thank you all.
Thank you.
And we will let you go.
Thanks, everybody.